For a community hospital in a relatively rural place, we are extreme early adopters of new technology. And not only are we early adopters, I think that we have physicians who have the skill and the courage, if you will, to take on new things because they know how important it is to be able to offer those things to the people in this area so that we can say, honestly, you don't need to go anywhere else to have this done. We can do this here. We can do it just as well, and you don't have to leave.
In North Carolina, there is a number of large tertiary centers and academic medical institutions. My goal was to find a place where I could provide that same quality of care with the convenience of it being local. When we came to FirstHealth, there was already a good team that had already been established here for cardiac disease, and there were very bright minds within the department. And it was the perfect setup for us to kind of expand on what was already good, and our goal has always been to make it exceptional.
What we're trying to do is what we call a heart team approach. We have a multi-specialty approach to patient care where we work very closely with other specialties. For example, interventional cardiology and cardiothoracic surgery will often evaluate a patient simultaneously to determine what the best revascularization method would be.
We work with the cardiologists and interventional cardiologists oftentimes after they've done their part, and then we take care of the rhythm issues. We offer all aspects of electrophysiology care and procedures that any academic center offers.
For the majority of problems that you're going to have with your heart, it's going to boil down to one of two things. It's either going to be coronary artery disease or valvular heart disease. For 95 to 97% of those problems, we can take care of them here. That's going to mean bypass surgery or stents. That's going to mean potentially valve replacement surgery, both open and transcatheter. So SAVR versus TAVR, surgical aortic valve replacement, or transcatheter aortic valve replacement. We do both of those, and we do them both well. Sometimes we have to do more than one valve at the same time. Sometimes we need to do bypasses and valvular heart surgery, and we're comfortable with doing any number of those kind of complex cases. We decided early on in our TAVR program that we were going to do things exactly the same way every time. Have the same roles, have everybody doing everything the same. The way that you get great at an operation is by not changing what you do, is by doing it the exact same way every time. Some people might find that boring. I actually love that. And that's how you obtain excellence. Repetition, doing things the same way, taking out variability.
The more you do, the better you get at it. So we have been able to give very good care from an aortic valve disease standpoint. When it comes to other valves, there are new therapies. We are able to provide a therapy called mitral clip to fix leakages of the mitral valve, not by open heart surgery, but by transcatheter methods, which significantly decreases complication rates, and it's a lot easier on patients that were not a surgical candidate. As new technologies have been introduced to the market, we fully expect to expand our program too.
We have 2 fully equipped EP labs that include all the modern technology, including 3-dimensional mapping systems. We offer implantation of all types of devices here, and something that we offer on the device side that very few community hospitals offer is lead extraction.
FirstHealth actually brings state-of-the-art, high-quality care, but at the same time, it keeps the community hospital feel. And I think the patient feels like they're in a small center, but if you look at what they're receiving, it's quite impressive. So FirstHealth is the perfect referral center.
As a referring physician, if you send your patients to Moore Regional Hospital, it's just an easy drive for them and their families to come here, and we have a place for them to stay at the Claire McLean House.
I think our ultimate goal is to provide the best care we possibly can while inconveniencing the patient the least amount possible.
What we aim for is exceptional care with the convenience of us taking care of you as if you're our family.
This is by far the best hospital I've ever worked in. And I think the reason why is that there is a positivity and a team-like approach to everybody who works there. If you're a patient, where else would you want to have your care than a place that's just filled with tons of professionals who are passionate about what they're doing and are doing it in a culture of positivity and can-do spirit? I don't know why you'd want to go anywhere else.